The title of my presentation is Cooking. My name is Israel Chika Igiru. A brief introduction to cooking. Cooking is a highly addictive stimulant drug derived from the coca plant's leaves. It can be smoked, injected, or sniffed and produces intense euphoria and heightened energy. Long-term use can result in dependence, health issues, and even death. Cocaine is referred to in the street with slangs such as coke, blow, snow, nose candy, powder, rock, Charlie, crack, base, C, dust, flake, white, and lady. These are all the terms used in noting cocaine. So when you have a person that start talking about these slangs, that brings your mind to what a person is talking about. And cocaine is one of the most widely abused substance out there in the community. History of cocaine abuse. Coca leaves euphoric effects have been known to humans for thousands of years. However, the first cocaine epidemic in America occurred in the late 19th century. Initially, there was no restriction on the sale of consumption of cocaine. Cocaine was readily available in pharmacies and saloons. Mail order vendors and even grocery stores carry cocaine. One drug manufacturer reportedly sold cocaine in 15 different forms in the 1885, including cigarette cheroots, inhalants, cordials, crystals, and solutions. There are numerous imported wines that also have cocaine in it, such as Vin Mariani contained a combination of coca and wine. The wonder drug was available as Coca-Cola and dozens of other soda pops and energy drinks for consumption on a budget. One of them even had a straightforward name, dope. Within a short time, the negative effects of cocaine became apparent, and by the 1920s, it was the most feared illegal drugs. The majority of states began to pass anti-cocaine legislation. In 1914, Congress passed the Harrison Act, which strictly regulated the distribution and sale of cocaine in response to the President William Taft's designation of cocaine as public enemy. Number one, by the late 1950s, cocaine use in the United States was no longer viewed as an issue. It is estimated that approximately 50 million Americans, or 1 in 4, have used cocaine today. And I have a reference for this reading, and that was DAS 1993. Prevalence and epidemiology in the United States. The annual average estimate prevalence of past year cocaine use among adults was highest in 2006 to 2007, and that was 2.51%, declined to 1.72% in 2010 to 2011, and then increased to 2.14% in 2018 to 2019. The annual average estimated prevalence of partial cocaine use disorder was highest in 2006 to 2007, which was 0.71%, and declined to 0.37% in 2018 to 2019. Characteristics associated with a higher adjusted odds of past year cocaine use included males. who ranges from the age 18 to 49, Hispanic ethnicity, income between 20,000 with 20,000 and or less than 20,000 actually. Large or small metro counties, use of other substances like nicotine, alcohol, marijuana, sedative, tranquilizers, prescription opioid, prescription stimulants, heroin, and methamphetamine, and serious psychological distress and suicidal ideation or attempts. And I have a reference for that, and it's Mustakian 2021. So a brief summary of this prevalence of epidemiology of cocaine use in the United States is that it ranges from these years that I mentioned, and the highest use was between 2006 to 2007, and we saw a decline in recently in 2018 to 2019, which the last recording was done, and that decline bring it to 2.14%. Whereas in between 2010 to 2011, it was 1.72%. So from this slide, we are talking about the ages of people who use cocaine the more. And we're saying that the males between ages 18 to 49 and males of Hispanic ethnicity whose incomes are less than 20,000 US dollars are the people who use cocaine the more. And they are large or small metro county dwellers. And also, if you look at it, it tells that these individuals are people that are also using some other substances and or people who have a severe psychological distress or issues. In this slide, we are looking at the risk factors of people that are vulnerable to cocaine use. And we are saying that young adults between the ages of 18 and 25 are more likely to abuse cocaine. And I think this age is the age of um, young adults trying to, try something new, which could be related to peer pressure or related to trying to belong or to, not be among the basic people in the society who want to try something new. And these are the people, the age range of people who are vulnerable to cocaine use and abuse. However, it's important to mention at this point that anybody from anywhere at any age could be vulnerable to cocaine use. In addition to the mention of anyone, anywhere, or male, female could be vulnerable, it's also important to talk about some of the other risk factors like the trauma, the availability of drugs, maybe in the family, or having somebody in the family who use cocaine, or somebody who is using other drugs that is, that can cause similar effects, and that's what we categorize into polydrug use. And overall, like I did mention in the first instance, anyone of any age can be vulnerable to cocaine use. It is important to mention that cocaine, just like every other drug use, can have certain side effects. So in this slide, we are going to be talking about the side effects of use of cocaine. And we are particularly going to mention the short-term side effects of cocaine use, which include euphoria and increased energy, dilated pupils, increased heart rate and blood pressure, constricted blood vessels, and increased blood temperature, or body temperature rather. And we are also talking about the insomnia, the anxiety, restlessness, and irritability that could be caused by cocaine use, the paranoia and hallucination that could also come from the excessive use of it, and nausea and vomiting, and decreased appetite. In these slides, we are going to particularly pay attention to the long-term side effects of cocaine use, and which include addiction and dependence on the cocaine, tolerance to the drug. And I want to mention something specifically about the tolerance, because the more the body gets tolerance, the more the individual needs a lot more to get the same euphoria effects that they experience from the drug. And that is what leads to overdose of cocaine. Then, other than that, the long-term side effects of cocaine use can also include cardiovascular problems such as heart attack, stroke, and high blood pressure, respiratory problems, gastrointestinal problems, neurological problems, mental health problems, sexual dysfunction, skin infection, and other health problems related to injection of drugs, like blood-borne diseases like you can get diseases like tuberculosis and HIVs and hepatitis from using the needles to inject cocaine in the vein. And also, you can also have the damage to the nasal septum and other parts of the nose from snorting cocaine. In this slide, we're going to be talking about the signs and the symptoms of cocaine abuse. These are the things the provider will see in a patient that will make you suspect that the patient is abusing cocaine, and you're going to channel your investigation or assessment towards that direction to know the actual intervention to, put in place. And these signs and symptoms may include runny nose or nosebleeds, sores or scabs on the skin, especially on the area where this cocaine is injected, rapid heartbeat, high blood pressure, sweating, tremors or muscle twitches, headache, nausea, and vomiting, even insomnia. All this could be a sign and symptom of cocaine abuse. We're going further into the signs and the symptoms of cocaine abuse in this slide, and that include increased talkativeness or hyperactivity, impulsivity or recklessness, aggression or irritability, restlessness or anxiety, paranoia or suspicion, changes in social behavior or relationship, financial problems or battle with money, secretive behavior or lying. All those things could be symptoms or things that can point the provider to the direction of beginning to investigate on cocaine abuse. Slide, we are going to be looking at the psychological symptoms of cocaine abuse. We did mention the physical symptoms earlier on. Now let's look at the psychological symptoms, which include euphoria or feeling of being high. This is one thing that every drug user talk about, and this is basically what they want to gain from using any drug. They say they want to feel high. That feeling of highness is euphoria, which they get from the drug use, and is a psychological symptom of cocaine abuse. And another one is depression or mood swings, poor judgment or decision making, memory problems or confusion, hallucination or delusion, psychosis or loss of touch with reality. These are the other psychological symptoms that will point the provider to knowing that an individual is abusing cocaine. In this slide, we do have a lot to talk about, but we are going to concise the whole slide into a very short summary of potential for overdose. Overdose of cocaine happen more than often in the society where the abuser of cocaine overdose themselves. If they are lucky enough, they end up in the emergency room, and if they are not fortunate, they overdose and die from it. So in this slide, we are saying that the frequency of deaths from cocaine overdose varies based on multiple factors, which include the geographical location, the prevalence of cocaine use, the quality and the purity of the cocaine being used, according to the World Drug Report 2021 by the UNODC. An estimate an estimated 9,900 deaths worldwide were attributed to cocaine overdose in 2019. And that's quite a huge number of people to die from cocaine overdose. And that happen often in the society where the intention sometimes is not really to die from it, but that happen from excessive, euphoria that causes leads to breath depression. And the frequency of this depends on the location. If the person is able to be, found while having these feelings or not. And that is what leads basically to death most of the time. Other than what is mentioned in the previous slides, on this slide we are still looking at the potential for overdose, and we are saying that cocaine overdose can cause various symptoms which include heart palpitation, chest pain, seizures, high blood pressure, and extreme anxiety or panic. Severe cases of cocaine overdose can lead to life-threatening conditions such as heart attack, stroke, and respiratory failure, and like mentioned in the previous slide, and that is where the death occurs from. It's important to go ahead to mention that the amount of cocaine that an individual uses or the frequency of the use of cocaine can, can contribute to the potential for overdose. Underlying health conditions such as heart diseases or high blood pressure, mixing with cocaine with other drugs or alcohol is one of the things also that can contribute to the potential for overdose. And if someone is experiencing symptoms of cocaine overdose, the person needs to be rushed to the nearest emergency as soon as possible. And if you're not able to do so, call the local emergency services to get the individual some help. In this slide, we're going to talk about the care plan for patients abusing cocaine. And it is important to mention that an individual reported to the emergency that is on cocaine overdose gets Narcan, which is a medication that will help reverse the overdose and bring the patient back to normal. Or it is a medication that will neutralize the effects of that cocaine on the patient. And in this slide, we are going to talk about the care plan that a provider will put in place to take care of the patient that is having cocaine dependency, or a patient that is being diagnosed of cocaine dependency. So the first medication we want to talk about, or the first pharmacological treatment, is buprenorphine, which is an opioid medication that can help reduce the severity of withdrawal symptoms of a patient, or that is associated with the patients going through cocaine detox. Another one is modafinil, which is a stimulant medication that helps reduce the cocaine cravings in patients that is trying to go away from cocaine dependency. We also have the disulfiram, which is an alcohol sensitized medication that can help reduce cocaine use by causing unpleasant reaction when cocaine is consumed. So we also have vigabatrin. It is a medication that can reduce the positive effects of cocaine by increasing the level of gamma aminobutyric acid, which is known as GABA, in the brain. So these are the medication that could be used to treat a patient that is going through withdrawal medication, cocaine dependency. In this slide, we are going to talk about a non-pharmacological treatment for cocaine dependency, and we are looking at the cognitive behavior therapy. You know, there are so many evidences out there that shows that cognitive behavioral therapy could be used in so many situations, and one of the biggest situations where it could come in handy is in a patient who is going through substance dependency, and cocaine is one of them. Another treatment strategy, which is non-pharmacological in nature, is the contingency management, which is a form of therapy that provides tangible rewards for staying drug-free. Another one is motivational interviewing, which is a great resource used in treating any form of addiction. It's kind of a therapy, a talk therapy that provides the patients with the option of realizing the need to change or to be cocaine free. Another program is 12-step program. These are support groups such as Cocaine Anonymous or Narcotic Anonymous that provide a structural program of recovery support and accountability for cocaine users. Another one is the family therapy, which is a form of therapy that involves family members in the treatment process to help the individual with cocaine addiction rebuild relationship and establish a supportive network that will help them in the recovery process. So in the care plan, we also have to schedule some patient education. This is education that can help the patient to understand what the treatment is all about and his own role to play in the treatment procedure to be able to be effective. And so in this patient education, we have to make the patient know that all this information provided is very critical to the healing process. We have to make the patient understand what addiction is all about and how it works with the brain. We also have to make the patient understand that there could be short and long-term effects of cocaine use, and we also make the patient realize or recognize the triggers or the things that make them want to use the drugs or the things that can trigger the cravings in them, and provide them with resources that can help them overcome these triggers or what we refer as coping mechanism. This treatment procedure can also include providing different resources such as various treatments available, and we did talk about this treatment in the previous slides. We also make the patient understand what relapses are and how to prevent those relapses, and the treatment the strategies that they can use to prevent relapses, especially when cravings seems to intensify. We also provide in that education a comprehensive, compassionate, and non-judgmental aim at helping patients understand their addiction and empowering them to make positive changes in their lives, changes that will result in healing. So if you want to bring this thing into conclusion, we want to end it by saying that cocaine use disorder is a condition characterized by compulsive use of cocaine despite negative consequences of one's physical and mental health, relationship, and daily functioning. It is a form of substance use disorder that can lead to tolerance, dependence, and withdrawal symptoms when drug use is discontinued. Treatment often involves a combination of medication, behavioral therapy, and support from peers and loved ones. And it's important to end on this note by note of telling the patient that it is doable. It might be difficult, but it is doable. Thank you and God bless. For further reading, you want to look at the references that I have written here.